We could say that uterus, the
breast,
breast, the prostate are those really well-known cancer, which being related to the hormonal, let us say, imbalance or hormonal abnormality. And the prostate cancer is the main really risk for it is age, and those patients with prostatic cancer is really age-related, and most of those patients are really above 60 years old, and of course most likely is related to hormonal imbalance. And we know the major treatment is to get rid of all hormonal testosterone in the body, and certainly is one of non-hormonal related cancer.
Thank you very much, Dr. Dahish. I think by now we have exhausted the causes of the cancer. Actually, it is, you have shown it in the slide there. Is there anything you like to add in the slide? Can we see the slide, Dr. Dahish, please? Can we see the slide?
Sure. Yeah, I just mentioned here the possible causes for human cancer. And in general, if we put the lifestyle cancer, which
you put it the first on the top, Doctor. Why? Occupation and then your lifestyle.
No, just because those, if we put all this together, it will be about 80%
altogether
of the possible causes of cancer. Then we come to the occupational cancer, idiopathic, heterogenic, which we ourselves could be a cause of it, is more or less about 20%.
You mentioned drugs, Dr. Dahish, right?
Sure.
Like what? Which one?
Well, drugs, let us say the drug we use in treatment of cancer, drugs which we use also in the those patients who, for example, have liver transplant, kidney transplant.
The immunosuppressive
immunosuppressive drug. We use this like azathioprine, cyclophosphamide. Those drugs certainly is associated with increased incidence of certain type of cancer, including lymphoma, Kaposi sarcoma, and so on. So those drugs which we use to suppress immunity and rejection of those transplanted organs are also, for example, is cause of cancer. Now, drug we used ourselves in treatment of cancer, let us say a patient who treated for certain type of lymphoma like Hodgkin disease. By 10 years, he have increased incidence of developing, for example, cancer of the blood, like leukemia, what we say. So this is more than the population. Sure.
Thank you very much. عندنا اتصال. Let us take the call, Dr. Dahish, and we'll come back. Yes, hello. Hello. ايوه.
السلام عليكم.
وعليكم السلام ورحمة الله.
والله كان عندي استفسار بس كانت عندي المدام.
مين معي الله يسلمك؟
أفندم؟
مين بيتكلم؟ مين معي؟
مدحت من حفر الباطن.
الأخ مدحت، تفضل. إيش سؤالك يا مدحت؟
أهلا وسهلا.
تفضل بي.
بالنسبة لزوجتي كان جالها هو سرطان عنق الرحم.
سرطان عنق الرحم، نعم.
اللي هو السيرفكس.
أيوه معروف، تفضل.
كويس، فكان هو تقريبا ستيج 2A.
2A، نعم.
كويس. فهي خدت علاج إشعاعي وعلاج كيماوي.
نعم.
كويس؟
تفضل.
بعد كده بس كنت عايز استفسر، هل هي الحمد لله دلوقتي الدكتور يعني قال ان هي ان شاء الله ما فيش كانسر ولا حاجه؟
الحمد لله.
خدت علاج اشعاعي الخارجي والداخلي.
طيب ايش اللي حابب تساله؟ تفضل. ممكن تسكر لو سمحت يا مدحت. مدحت ممكن اما تسكر تخفض التلفزيون اللي قدامك او تطفيه بس عشان نسمعك بوضوح. تفضل. او تبعده عنك شويه.
انا عايز ادخل بعيد اهو.
تفضل.
فعايز استفسر عن امكانيه ان يحصل ري اكرنس ثاني يعني.
عن ري اكرنس اوف سيرفايكال سي. هي كم عمرها الله يسلمك؟
حوالي 40.
40 سنه. ايوه. في في كان مصاحب للشيء، يعني هي عندها لا سمح الله بتدخن او اي شيء؟
لا ما في.
ولا في عندها لا سكر ولا ضغط ولا شيء؟
ولا حاجه خالص.
بس عملوا لها العلاج اللي هو بالكيماوي؟
علاج كيموثيرابي وراديوثيرابي وفي الانتراكافيتري تقريبا.
بس انتراكافيتري. طيب خليك معنا نحن
في اي سنه؟ قبل كم سنه؟
كم سنه؟
كم سنه لها؟
مش سامع كويس.
متى عملت العمليه؟ متى اخذت العلاج؟ متى شخصت؟ من 5 شهور شخصت عندها سرطان العنق الرحم.
هي خلصت العلاج كله من 5 شهور.
من 5 شهور. طيب شكرا لك، خليك معنا على الهواء ولو في شيء ممكن نسالك. طيب شكرا. تفضل دكتور داهش.
طبعا العلاج اللي اخذته المريضه هو الامثل، صاحب علاج بالاشعاع وعلاج كيماوي طبعا كجزء من العلاج ما قبل الاشعاع، او ممكن ناخذ مع العلاج بالاشعاع، وكذلك علاج بالمواد المشعه داخل الرحم. فهي اخذت العلاج الامثل، وحسب كلامه انه الطور الثاني فنسبة رجوع، طبعا المرض ذا هو من النوع اللي ممكن يتشافى بالعلاجات هذه إن شاء الله، وإن شاء الله أن يكون نسبة الشفاء عالية. إيش احتمال أنه يصير لها مضاعفات؟ طبعا هذا يعتمد على عدة عوامل، فأحب أن أتركه للطبيب المعالج إنه ممكن يسأله، ولكن بصفة عامة في الطور هذا وبالعلاج الأمثل إن شاء الله تكون النسبة لا تذكر يعني احتمال الشفاء من المرض ده نسبة عالية إن شاء الله.
الحمد لله. يعني دكتور أخ مدحت، الدكتور داحش حاب يطمنكم إن شاء الله إنه ما يصير فيه يعني مضاعفات أو يعني لا سمح الله دور ثاني مرة. لكن إيش الأشياء ممكن إحنا ننصحهم فيها يا دكتور داحش بحيث إنه يتابعوا الحالة تبعتهم؟ تفضل.
طبعا أنا متأكد إن الدكتور اللي أعطاه العلاج
نعم.
تقريبا العلاج الأمثل
نعم.
إنه ماخذ طبعا المتابعة منتظمة، وخاصة الفحص الموضعي وعمل الأشعاعات للباطن
نعم.
لاكتشاف إذا كان هنالك رجوع للمرض أو انتشار في الغدد الليمفاوية. ولكن طبعا احنا ما نحب أن نعطي النصائح بدون ما نعرف الحالة، لأنه هناك عدة عوامل كيف صحة المريضة، مع مقدار درجة المرض، الجريد اوف ذا تيومر، البلك حقه، فعدة عوامل تختلف مقدار استجابتها للعلاج. فكل هذه الأفضل أن الطبيب المعالج بيعطيها، ولكن بصفة عامة العلاج اللي أخذته هو العلاج الأمثل، وهو العلاج الأنسب اللي يعطي نسبة عالية من الشفاء. وإن شاء الله بالمتابعة مع الطبيب، وخاصة مع طبيب برضو الأرحام، وبالمتابعة بالمنظار والأشعات المقطعية للحوض، إنه تكون النسبة عالية. وإذا في أي شيء لا قدر الله طبعا في علاجات أخرى مثل الجراحة وما شابهها.
شكرا دكتور داش، إن شاء الله إن ما يكون في أي مشكلة. طبعا we have a question in Arabic. We have a 40 years old. She has CA cervix, stage 2A. She received chemotherapy and she received radiotherapy. The question was the recurrence rate. Dr. Dash, do you like to answer in Arabic, in English, please?
This is the question. This patient, she has C cervix, stage 2A, treated with chemo, radiation, external as well as intracavitary. And this is the ideal treatment for such a stage. Most likely this patient will have excellent response rate and cure rate. Still, we cannot really give a percentage, because this sometimes depends on the many factors, and the best one to estimate really her chance of recurrence is her attending physician. But most of the time those patients really have high percentage of cure, and this type of cancer is curable in an early stage, and that usually the patient, if they fail radiation, they could go for surgical intervention. But hopefully this patient will have excellent cure and good response.
Thank you very much, Dr. Dash. And the other question, how do they follow up themselves, and what she should look after her?
Usually the treating physician, the treating radiation oncologist or medical oncologist as well as gynecologist, usually they will give them in a program for follow-up, including physical examination, pelvic exam, looking in the cervix, etc., doing CT scan for the pelvis from time to time, and certainly if they see any evidence of recurrence, they will do further investigation, and sometimes those patients, they will go for surgical intervention and surgery. But usually those patients will have regular, well-established follow-up program, usually in the first years, every 3 months, then 6 months, and so on.
شكرا يا أخ مدحت. Thank you very much for calling أخ مدحت. Can we'll carry on our slide, Dr. Dahish? Can we have the next slide? So we have exhausted the causes. Can we have the second slide, please? You recommended last time, Dr. Dahish, that especially this was an advice that please in the diet always try to. What is your recommendation about the diet? Just a simple and general talk, please.
Yes, with the diet, we always advise the diet to be low-fat diet and low in fat and high in fiber, and should be balanced diet in general. Now, try to avoid all those really diet with a lot of additives, diet which is maybe which is high in fats, those diets which is also low in fibers, and we generally advise the population to have balanced diet. Now, there's a lot of carcinogens could be detected in certain additive to diet, but usually they play minor roles. Now, a lot of people, they say try to avoid, for example, those smoked meat, those meat with the high fat, white meat, and so on. So those are the things which should be avoided. And in fact, I have a slide, but it's not really following this, which is really try to cover most of the important things in the diet. Of course, they should avoid alcohol and all other things which is not really proved additives to the diet.
Maybe the slide unfortunately is not working,
Yeah.
but I just like to ask a question, doctor.
Sure.
Sometimes when when we have a meat and we just keep cooking it in the oil so recurrent, so many times. Thank you very much. He told me that the slide's on. This oil, doctor, boiled oil, I mean this boiling oil for a long time, does it affect this meat which is boiled in it?
Not really, but those diets which is really high in fat in general,
Right.
whether it is really a plant or animal fats, it's usually not really ideal diet and
Right.
associated with increased. Most of the study, those diet which is high in fat is related to the increased certain type of cancer, for example, breast, uterus, and so on.
Right.
But in general, to put a specific really, let us say, cooking habit or cooking method,
The cooking habit,
it's
sure.
really very difficult to
Sure,
prove it.
to talk about it. Thank you very much, Dr. Dahesh. We'll talk about the symptoms, please, or
Yeah.
what is symptoms, things which appear on the patients or on the person related to cancers. Yes, Dr. Dahesh, the slides are also ready
Yeah,
for you, please.
the symptoms of the cancer, we could say that the cancer causes symptoms due to by many ways.
Right.
One of the most common way is really direct involvement of the organ which is affected, direct extension,
Right.
and also the symptoms. This is what we call due to tumor direct.
Right.
Now, the other symptom is related to the tumor in general, which is the remote effect of the tumor, and we mentioned one before, like fever, weight loss, and so on. So the symptoms for any cancer is related to the cancer itself. Where is
Right.
the cancer?
Right.
The site of the cancer, is it in the brain, is it in the lung in general?
Right.
So the symptoms of each really cancer is related to the organ involved.
Right.
There are certain symptoms which I want really to warn the
audience.
people,
Yes,
the
please.
audience there.
Right.
And we sometimes call it really symptoms. When the patient have those symptoms, they should seek medical advice.
Right.
One of them is really when the patient have change in the bowel habit. Could we have the first slide?
Can we have the first
First
one?
slide.
Or
So
we
this-
can comment. What is this, Dr.
Okay.
Dahesh, please? Let us have
anyhow,
this one.
the first slide is patient with cancer of colon, so
Right.
his presentation will be changing the bowel habit.
This is one.
So he's usually have regular bowel habit, now
No, we want the one before this one. Dr. Dahesh, you said change في البول habit.
change
Can
in
we
the bowel
elaborate
habit, or
on that?
urinary habit.
Like what?
Somebody who's really go to toilet regular every day, and then start to have change in that. For example, he start to have constipation for 2-3 days, followed by diarrhea.
Difficulty in passing stool, pardon me?
Difficulty. It's
Right.
not necessary, it's changed. They are now, before he used to have regular bowel
Right.
movement daily, now he start to have constipation for a few days, then he will have diarrhea. Now, this means there's something
Going
could
on.
be going on. This could be related to the diet. It's not necessarily this is really important symptoms, but we advise those patients who notice those symptoms to seek medical advice.
Sure.
Now, the other thing is those patients, for example, when they have abnormal lesion, let us say ulcer, which is not healed, which has lasted for a long time.
Right.
Like, for example, that ulcer before, which is related to breast cancer. All the patient have a
Dr.
swelling.
Dahesh,
Yes?
I'm sorry, we have to close and we'll carry on next episode.
Sure.
Thank you very much for being with us, Dr. Dahesh. We really bothered you. Sorry, I know that you just came from the hospital to the program. You've been very kind. Thank you very much, dear viewers, for being with us. Wassalamu alaikum wa rahmatullah. We'll see you next Saturday, inshallah, at the same time. Thank you very much.
Thank you.